Good afternoon, everyone. You're all very welcome. Thank you very much for joining us here today for this webinar introducing the HSELanD project. My name is Pat Kenny, the National E-Learning Manager on HSELanD, and I'm joined in the co-pilot seat by my good friend and colleague, Maureen Murphy from Orion Learning. Again, let me welcome everybody to this webinar. Some of you may have heard of the HSELanD project. The purpose of this morning's webinar is to just provide you with an overview of what we've been doing for the last number of months and what HSELanD is going to make available to you as we roll it out across the country. So here we go, I hope. Okay, so what we're going to cover today is to introduce those of you who are learning and development administrators and educators to some of the processes and the functionality that's going to be available to you via HSELanD as a result of the work that we're doing on the HSELanD project. I'll also play a little video later on that will show you some of those functionalities in action. If you like, it'll present you with a brief tour of some of the things that HSELanD is able to do. Before I go any further, I should acknowledge the help and assistance, the collaboration that we have been getting from our colleagues at Tallaght Hospital in Dublin. Tallaght Hospital is where we have done our first implementation, and I'm very happy to say that that implementation is progressing very handsomely indeed, and we are estimating that we will be finished and up and running by the middle of May this year, which is really exciting. So first of all, let's go back to basics. Our role on HSELanD is, and actually always has been, to assist you to deliver the very best quality training programs and learning support tools that we can through the HSELanD medium. One of the key advantages of this is that it allows for educational resources to be produced and made available in a medium that people can use whenever and wherever they wish. Now, in that regard, those of you who are nurses and midwives will know that on HSELanD there's already a very comprehensive catalogue of clinical programs for nurses and midwives on HSELanD. What HSELanD is going to do is to introduce the ability to advertise, if you will, and to manage your classroom training via HSELanD. One of the big advantages of this is that it will massively reduce the overhead that you currently have to deal with handling those processes manually, if you'll pardon the phrase. So we'll take the paper and all of the toing and froing out of the process for you. So, as I said, we are currently implementing what we might refer to as an enhanced HSELanD e-learning management system feature. And as I've said to you, Tallaght Hospital is our first adopter hospital. And essentially what educators and learning and development administrators are going to have at their disposal is actually a fully integrated online facility, which will allow you to take your current prospectus of courses, post them onto HSELanD. Your colleagues then on the wards will be able to look at those. They'll be able to make choices about the programs that they wish to enroll on, and they can do that online. So there's no need for phone calls or emails. The whole thing will be done online. As a result of this, how you manage your classroom, waiting lists, and so on will all be done automatically for you with the LMS. But at all times, you'll have the ability to go into HSELanD and intervene in the process if you wish. You'll certainly be able to get real-time information about how many people are currently enrolled in the course and how your waiting list is going. Now, once you've run the course, you'll then be able to run reports on that course. So how many people attended the course? Who were they? Where were they from? How did they do? If you've had an exam or an assessment at the end of your course, you'll be able to get information on that. And you can then share that information within your organization as is appropriate. So sometimes you'll need to be sharing very detailed information on course attendances. Other times you'll merely be sending statistics. But you're not going to have to keep constantly trying to figure out how many people run the course. The information is all there in HSELanD automatically for you to use. That will significantly enhance your ability to use that data then to make ongoing decisions about your learning and development strategy. Just bear with me whilst I get the computer to behave as I wish. Now, so let me introduce to you a short story, if you like. It's probably the best way for me to describe the functionality of HSELanD. And here are our three imaginary colleagues: Nanita, who is a staff nurse; Brian, who works in learning and development; and Miriam, who sits on your hospital's senior management team. Now, I should pause at this particular point and acknowledge and apologize to any of our colleagues who are working in the community. HSELanD is all about the entire health and social services. It is not if you like, a one-service sport. HSELanD is available to everybody right across the health spectrum. And whilst I'm in this territory, I'll also remind everybody that HSELanD is available to people who work in non-HSE services, such as the what we used to refer to as the DATs, the voluntary hospitals, the voluntary sector in the community. We have approximately 85,000 people currently using HSELanD right across that spectrum. So back to our characters in our story. So as I said to you, Nanita is a staff nurse. She works on a surgical ward, and she joined the hospital approximately 6 months ago. Her manager has recommended that she undertakes training in a number of areas. Now, this is one of the, if you like, the core or key functionalities that HSELanD and Helm offers. So I talked to you earlier about how your colleagues can enroll on courses, and absolutely they can, but equally, it will be possible for managers or educators to make recommendations or even mandate certain courses for different groups of staff and have the LMS manage that. So if, for example, we were saying that Nanita had to do a course, let's just keep it simple, say on moving and handling, we can mandate her to do that, and when Nanita next goes into HSELanD, she will see a message saying that she has to do this course, and it will tell her how long she has before she has to complete it. Now, as things stand right now, if you imagine how, just think for a minute how you manage those things right now. It tends to be on the basis of a fair bit of paper, often I'm told quite a few phone calls, and constant checking backward and forward to make sure that people are taking the training that they need to do. And actually, it's a very complex and a very sophisticated operation, and it's a credit to our colleagues across the services that they manage to do this. Our aim here is not to interfere with that, but to provide you with facilities that will make that process simpler for you. The last bullet point refers there to other information that Nanita will be able to see. So every time she goes in, she'll be able to see upcoming events that are that may be of interest to her, and she can choose to enroll or not, as she sees fit. This is just, it's very blank, as you can see, but this is an example of the kind of thing that Nanita might see. And as you can see, there are a small number of entries there, and these would be things that she's already put into her personal calendar, and they'll act as reminders when those events are actually going to occur. This is a picture of Nanita's training plan. Now, again, we're very early days here, but you can see how Nanita can be presented with a very visual representation of the training that she needs to do. And indeed, if you look at those watch color, what I call them, kind of orangey boxes there, innovation, leadership, and so on, they're red, which means that she hasn't actually started those yet, but those little triangles change color to indicate that they're completed. You can see the little glyph at the top there running from green to white, completed, in process, needing action, and optional. Okay, moving right along. I hope that everybody is able to hear me. I don't actually have much of a sense that that you guys are. I'm kind of taking it on faith. Maureen has given me a thumbs up, so hopefully some of you are communicating with her. Do feel free to enter in any questions that you have in that chat box. I'm going to do my best to deal with some of those later on. If we don't get to them all, I do promise you that we'll review them and deal with them after our webinar and post them somewhere you'll be able to see. So thank you all for sharing any questions that you have thus far. Now we're going to talk about Miriam, who works in the hospital senior management team. Now, her primary role in relation to learning and development is to drive efficiencies in certain areas. So it's really to make sure that people are skilled up in areas that the senior management team have determined are important priorities, strategically speaking. You know what I'm talking about here. Somebody decides that maybe we need to concentrate on our communications, for example, if maybe there's been a bit of an issue with how people perceive themselves to be communicated with, or any other area. It could be a clinical area. So her job there is to make sure that the relevant training and skills updates are being done. Now, in order for Miriam to be able to do her job, she doesn't need micro detail. She certainly won't need lists of names of people who have done courses. Even insofar as she's trying to develop a new competency-based performance framework, as you can see there from the middle bullet, what she's going to be primarily interested in are the kind of statistics and graphical information that I'm about to show you here. This again is just an example of the kind of visual information we can provide to somebody who needs to think strategically about learning and development. Hopefully you guys will be able to make links. You can see that this is not really relevant to us in health, but it's just an example of how you can pull together the wealth of information that's on HSELanD so that you can very quickly compile reports and start getting really good intelligence from those reports, which will help you to make strategic decisions about your ongoing operations. Now, Brian, on the other hand, who works in the learning and development team, his primary responsibility is to make sure that the courses on offer, the opportunities on offer, are actually meeting, on the one hand, the needs that Miriam and her colleagues on the SMT have identified, but also that he's listening to and providing resources that are relevant to staff on the ward floor. Now, what he needs to do is he needs to be able to monitor the ongoing activity in rather more detail. And again, using the very same data, he can get a very different view of courses, who's attending, where they're coming from, how they're getting on, and indeed on HSELanD, it is perfectly feasible to attach surveys or evaluation templates that will provide Brian with really good information about whether people think that a particular course was relevant to them, whether it hit all the spots, or whether it needs a little bit of attention. Now, so again, here's a picture of a graphical interface, if you like, that somebody like Brian, or perhaps even a line manager, might want to look at in relation to his or her team. And what you're getting here is an overview of a particular group of people, and clearly we can define which groups working in collaboration with yourselves, but right now we're just talking about a team. So it might be a team of nurses on a ward or in a particular department within a hospital, and a line manager can get a really good overview of where the whole team is at, and that's going to become, as I'm sure you all know, more and more important as CPD gets more traction within our services. Okay, now let's all we'll take a little breather now. What I'm going to do now is, you don't need to do anything. I've got a video that you might watch. There's very little sound on it, so you don't need to worry if you can't hear sound. I'm not talking through it. The video takes just shy of 6 minutes to run, and my only purpose in presenting the video to you was just to provide you with some additional visuals, if you like, of what HELM is going to look like, and one or two of the core tasks that you'll be able to perform. Don't be trying to make notes or anything like that. It's not setting itself up as a training video. It's purely for your information. So sit back and enjoy. As soon as the video is over, I'll start talking again. Hopefully all of you will be able to watch it. If it starts freezing or getting stuck, don't worry, it's probably because the bandwidth wherever you are is maybe a little bit low. Just bear with us, and I'll get back to you in about 6 minutes' time. So here we go. Now let's just go back to the start. So Kira's just letting me know there that she's not hearing any. I had picked a really cracking good music track for the back of this video. If you're just listening in silence, my apologies for that. But hopefully you can see the video and get a gist of some of the things that you'll be able to do on HSELanD. You can see how bad I am at typing too. So when we're creating a session, what we're actually doing is scheduling classrooms for the course that we've already created on HSELanD. And you'll see actually in a couple of seconds me scheduling our webinar, which was, as you know, scheduled originally for 2 weeks ago, but we postponed because of the weather. Okay, welcome back, everybody. I sincerely hope that all of you have been able to watch that without too many interruptions. What I'm going to do now is I'm just going to hand over to Maureen, because I know that she has 1 or 2 questions that people have submitted. So we'll take a couple of minutes now just to have a listen to those and maybe provide some answers. Maureen?
Thanks, Pat. Hopefully able to hear the audio now. So a couple of questions, if you don't mind me naming names. So Maura has asked the question, Pat, can this work between acute hospitals and community partners in relation to study days?
100%, Mara, it certainly can. I was saying to you earlier that HSELanD is set up, always has been set up to be available to people irregardless of where they're working in the health or social services setup. So we're well capable of managing collaboration between community and hospital services, and certainly hospitals will be able to advertise courses or make them available to people beyond the hospital campus. All of those things are things that you get to decide to do, but you can rest assured that HSELanD is well able to accommodate them.
Okay, so our questions are coming in thick and fast, which is fantastic. So please feel free to post some more yourselves. So Susanna's asked the question, will there be an option to host webinars like the one we're using today, Pat?
Well, yes, there certainly is the capacity to host webinars. Now, let me just talk a little bit about how that might happen. So once we roll out Helm, for example, Susanna, you'd be able to advertise your webinar on HSELanD. You'd certainly be able to allow people to enroll in that webinar. HSELanD itself doesn't have webinar technology built into it in much the same way as we're using GoToWebinar here now. You would use something similar. Now, as you know, the HSE has Microsoft's Link software installed throughout the country. You can certainly run webinars on that, but equally, that's not to everybody's taste. You can run your webinar on any of the proprietary webinar technologies that you have access to, but you can do all of the management of that, the enrollments, waiting list, and so on through HSELanD. And when you have completed your webinar, if you've recorded it, like we're doing here, I hope, then you can post that onto HSELanD so that those people who haven't been able to make the webinar live can watch the webinar later on. So hopefully that answers your question.
Thanks, Pat. And just to confirm this, the webinar is being recorded and we will be making it available online on a number of different ways through the HSELanD website and within our Nursing and Midwifery Hub. Now, just coming on to another question, and I might just combine two questions together. So Marisa and indeed Marianne is interested in the plan for rolling out this programme nationally, and indeed just as within that, is it designed for all the hospitals? Are they all HSE, or does it also include our voluntary hospitals, Pat?
Okay, thanks for those questions, and it's an important issue. 100% this project will be made available to all of our hospitals. It's not just HSE. You probably know, Marianne, that people from the voluntary hospitals and indeed from the voluntary sector in the community have always been able to use HSELanD, and we are wanting to continue to welcome those people to HSELanD. So we have a revolving door here. We don't want to be putting any blocks on anyone. In relation to the national rollout, yes, we do have a plan. Let me tell you a little bit about how we've approached this. We've been working with our colleagues in Tallaght Hospital for a good period of time now, almost a year and a half. And we spent the first year working very closely with them so that we understood exactly how they currently manage their learning and development, so that we could then make sure that the Helm project and HSELanD provided them with a system that was actually going to work with them, that was going to work for them, and not actually create a whole heap of changes that were going to be difficult for people to manage. So having spent loads and loads of time at that, people typically call that process, doing change management. It's not a particular phrase I like, but you get what I mean. Once we had all of our processes written down and our colleagues in Tala were happy with them, that we had, if you like, represented how they work accurately, we then shared those processes with a group representative from around the country, from hospitals and communities and corporate services, and we asked them to review the processes. So the kind of work processes that we agree were, for example, how do you typically create a new course here in Tala? We wrote process documents then that would describe how you would do that on HSELanD, and then we shared that with our national reference group, as I said, a group made up of representatives from around the country, and we asked them to review them. So what we've been able to create, if you like, are a core set of processes that, in broad brushstrokes, everybody across the country agrees represents typically how people manage these things currently. Our job then is to transfer those processes into an online environment, and we've managed to do that. As I said earlier, we are anticipating that we'll be ready to, our technical friends use the phrase go live in mid-May. Now, once we've done that, we're going to be reaching out to services across the country with a roadmap, if you like, where we are going to encourage hospitals and CHOs and other services to come on board with us, and then we will work with them over the coming year or 2 years to implement the HELM project across the country. Now, again, in that regard, our priority here is to make sure that if HELM is coming to your service, that we do that in a way that is of help to you. We're not looking to get in anybody's way. So we've created a project roadmap that will allow us to work in partnership with you and give you the time necessary to make the transition from a largely paper-based activity to an online activity. And typically we think that it'll take about 12 weeks to work in each service because of all of the effort that we've put in with our colleagues in Tala to understand those processes correctly. So yes, HELM is coming your way, and we certainly hope that we'll be working with many of you throughout the remainder of 2018 and into 2019.
Okay, thanks for that, Pat. Now, Joanna has posed a question, maybe just for clarification, about the programs. Now, I can maybe answer this one if you wish, Pat. Are the programs hosted on HSELanD, or is it just a link to courses run by the hospital? So maybe just by way of clarification, when HELM is rolled out within our local hospitals, and indeed our CHOs over time, every hospital will have access to everything we've already got on HSELanD in terms of there's over 180 online learning programs. So our hospitals will absolutely still have full access to that. But in combination with that, we'll be able to set up their own local course catalogue for all the classroom-based events that are happening locally within the organisation. And indeed within that have the ability then to upload your own resources that would be attached to those courses, and maybe pre-reading, assets, post the live event course. So it's absolutely local ownership to maintain the course catalogues and everything that surrounds our classroom-based training, or indeed our blended learning model, which we're really trying to advocate going forward through HSELanD. I think Pat's going to touch on that in terms of a workshop that we're hoping to run in September 18. But we'll come to that towards the end of Pat's presentation. So hopefully, Joanna, that's answered your question.
Okay, well, thank you all very much indeed for those questions. Keep them coming. We're absolutely delighted to answer any questions that you guys might have. Okay, so onwards and upwards. Just doing a quick time check here. It is just approaching 12:40. I reckon we've maybe another 5 to 7 minutes to go. I know many of you will be starting to think about lunch. So just want to remind everybody, we're on track, we're on time, and we'll certainly be finished a little ahead of time. We've obviously had a good tailwind, so we should be landing a little before 1 o'clock. Okay. So let me, when I can get this working, here we go, dancing. So a little bit of information about HSELanD during 2017. And again, purpose of this is to just let you guys know, to confirm that HSELanD already enjoys a very widespread coverage throughout the country, throughout all of our services. During 2017, we had a total of, as you can see there, just under 80,000 active users. Now, active users means people who have been in to do something on HSELanD within the previous 6 months. All told, actually, we've had many multiples of that. Well over 150,000 people have used HSELanD since it first began in late 2004 and early 2005. In that regard, HSELanD is probably one of the largest e-learning portals within the health sector across Europe. It would be on a par with some of the larger e-learning portals currently running within the NHS, certainly. The total number of new users that we had in 2017 was in excess of 30,000. So 30,000 new HSELanD learners joined us during that year, which certainly we're very happy with. I hope you'll agree, is an impressive number of people. We've also had the advent, if you like, of our first major mandatory learning programs. Many of you will have, perhaps even all of you will have completed the Introduction to Children First, which, as you know, is being rolled out right across the public sector. So not just health, everywhere, education, civil service, public service, anybody whose job might take them into contact with children. For our part, we have had over 45,000 of our colleagues completing the Introduction to Children First on HSELanD. Hand hygiene, almost 30,000 people. Again, these numbers are impressive because, as you know, hand hygiene is one of the critical ways of reducing the incidence of hospital-acquired infection. Now, okay, it looks like I inadvertently hit the mute button on my microphone. I am dreadfully sorry about that. Really glad that Maureen has drawn my attention to it. We're nearly wrapping up toward the end of the presentation. I hope that little interruption of silence hasn't been too distracting for you. What you're looking at here is a pie chart that shows the distribution across the various disciplines within health and social care. And as you can see, our colleagues in nursing and midwifery make up the very largest portion of people using HSELanD at 55%, followed by clerical admin staff at 20%, and then our colleagues in health and social care at 15%. So HSELanD continues to grow, and hopefully with the introduction of the HELM project, that pattern will continue. Okay, here's some just useless pieces of information. Wednesday is the most active day of the week, Sunday the least. But actually, here's something that's worth drawing your attention to. We have spikes of activity. These are just general average spikes, but quite a lot of people use HSELanD at night to do their learning, which I think is a testament to the level of commitment that our colleagues have to, one, their own learning and development, and two, to their role within health and social services. We've won a number of awards throughout our history, including a number of Irish e-government awards, and also we've collected 3 Brandon Hall Gold Medal Awards, which essentially means that HSELanD has come out first, not just in Ireland, but actually in the world. And that is largely due to the willingness of our colleagues right across the health sector to work in collaboration with us to develop learning activities. So, okay, now Maureen is signaling to me here. Let me just see what she's wanting to draw my attention to.
Yes, Pat. Just a couple of really interesting questions. Well, there was one around the linkage with SAP. Is it required going forward to implement HELM? And indeed, with regarding to the national rollout, has a decision been made in relation to which sites, we will be rolling out HELM to over time? And Maura was very interested in the challenges that Tallaght faced in terms of staff engagement. So maybe even just to address one of the, the question regarding rollout. Obviously, we're at the early stages now with our Tallaght. So is there anything that you could share in relation to that over the next period?
Yeah, well, thank you for that question. Yes, there is. The first thing I want to say is that the HELM project and HSELanD is for everyone in our health and social services. So we are absolutely not going to be excluding anyone from any area of HSELanD. We never have, and we never will. That's point number one. How we're going to roll out is we're not sort of wanting to be sitting in some ivory tower saying, okay, well, we'll do this hospital first and we'll do that one second. I'm sure we'll push the other hospital there down a little bit down the list. What we're actually going to do when we have successfully completed our work in Tallaght is that we're actually going to communicate with all of the hospitals, we're going to communicate with the CHOs, and we're going to invite them, if you like to self-select, tell us when would you like to begin work on HELM. So largely, if you like, the order of implementation is going to get determined by the services themselves. We already know that there are 1 or 2 hospitals who are absolutely chomping at the bit to get involved with HELM and to implement HELM at their locations. There are other services that are equally interested in doing HELM and doing this work with us, but who are also signalling that they're not quite ready and they'd quite like to push it a little bit down the road. So what we're going to do, if you like, is engage with the service as a whole and work out a sensible implementation plan. And hopefully, those of you who are with us today will be able to use your influence. I hope that you have a positive impression of what we're trying to do, and that you'll be able to encourage your colleagues to engage with us to work with you with HELM. The one key message that I would want to leave all of you with is we are not here to impose anything on you. We absolutely want to work in partnership and in collaboration with you. And we really, really do mean that. I believe it's how we've always worked since we started, and we're totally committed to keeping working that way. In relation to, because it's worthwhile dealing with, the challenges that have been faced by TALA, I think it's a really, really sensible question. I think that when we have finished our implementation with TALA, it would be really good to invite Sandra and some of her colleagues to perhaps I don't know, provide us with a reflection, or maybe even do a webinar, and we might even consider a joint webinar at some point to talk about some of the challenges that we faced. But again, in deference and in recognition of our colleagues at TALA, I would want to say that from our perspective, we have met with nothing but willingness, enthusiasm, and collaboration. Maureen?
Thanks for that, Pat. And maybe just one final question to wrap up, which I think is very important for our target audience today, in relation to how we'll link with the CNMEs and the NMPDUs, within our nursing midwifery community. In relation to, I made mention of the workshop that we're hoping to run, Pat, in September. Maybe just share with everyone what the plans are for that.
Okay, so well, as some of you will know, we already work very, very closely with a number of the CNMEs and NMPDs, and we work especially closely with our colleagues in the ONMSD, and that's something that's been going on for some time. We also have a governance group for online learning within ONMSD, and both Maureen and I are members of that group. So first of all, there's a well-established and very close relationship between ourselves and our colleagues in nursing. In relation to how we're going to engage with the CNMEs, certainly we'll be working with the ONMSD to work out the best way for that. But I can assure you that your colleagues in some of the CNMEs and the NMPDs and in ONMSD have already made it crystal clear, we kind of knew this anyway, that nursing has a particular set of requirements. You guys are providers of critical education, and you also need to be able to get access to reports. You need to be able to manage the activity that you're doing. And again, this is something that with Sandra in TALA we're already doing. Some of you will know that Sandra has responsibility not just for nurses, but also for all of the other areas in education. So we're already on track, but we do know that we will have to work directly, really looking forward to it, with our colleagues in nursing and midwifery. Now, hopefully that gives you some reassurance, but we're on target to do that. So Maureen then just mentioned, just by way of wrap up, that actually we were just having a conversation with your colleagues in the ONMSD yesterday. We're planning a number of events in the autumn of this year, beginning with a workshop. You'll hear more about this from the ONMSD and from Mark White, where we're going to start talking in more detail about HELM, with particular reference to the CNME NMPD requirements, in other words, nursing and midwifery requirements. And we'll be following that up with a series of online events where you'll get more and more and more information about HELM, about HSELanD, so that you're well placed to begin to use the resources as they come on stream wherever you are. Okay, so I think we've just about come to the end of our presentation. I'd like to thank both Maureen and Ciara, first of all, for helping me with this. It's great to be able to do these things online, but I promise you, it's not for the faint-hearted either. There's lots of things to look after. So thanks to Maureen and to Ciara both. Let me thank all of you for joining us today. I hope that the presentation has been enjoyable for you. More than that, I hope that it has given you relevant information and whetted your appetite for the work that we're doing. So again, thank you. Have a great afternoon. Bye now.